I'm Luke Wedevin, and this is my dad, Chris Wedevin, and he's an anesthesiologist who recently returned from a medical mission trip to Honduras.
That's right, Luke. I did.
Dad, could you please tell them what you do in your job?
Well, I'm an anesthesiologist, so that means that when people are having surgeries done or any kind of procedure in the hospital that requires someone to go to sleep for the procedure, I'm the one who gives the medicine and monitors patients who have these surgeries, and to, like I said, make people go to sleep, make sure that they sleep safely and that they're comfortable throughout the procedure.
So what did you do on the mission trip?
So we took care of patients in the area of Gracias, Honduras, which is a really poor area of Honduras where there's not a lot of access to specialty health care.
Estimate how many people you helped in a day.
Well, it was a 4-day trip. We took care of about 1,000 patients between surgeries, and there's also some dental work that was done, also some other medical doctors that were with us. So about 200 patients a day that we took care of overall. Surgeries, probably about 20 patients a day.
Okay. What kind of surgeries were done?
So it varies from trip to trip. We go on this trip every year with an organization called the Luke Society, which is a Christian medical missions group. This particular trip that we went on, we had ophthalmologists, which are eye surgeons. So we did surgeries on people's eyes, as well as some doctors who take care of people's stomachs and intestines. So people had some surgeries in that area as well, and like I said, I provided the anesthesia for people having those procedures.
Okay. How did they get the injuries?
Not all the patients we took care of had injuries. Some of them did. Many of the folks, because these are rural farming communities, many of the folks use tools, and in particular machetes machete injuries tend to be a common injury. So people getting injuries to their eyes and having to have repair with that. The other thing that is common in Honduras is lack of adequate dietary, food and water resources. So many of them, even kids, develop what's called cataracts, which is cloudiness in your vision that needs to be repaired surgically, and so we provided those surgeries for those people as well. This year we didn't see any, but sometimes we also see people who have parasites, which is from inadequate sanitation. They don't have good running water, bathrooms, clean water like we take for granted here. They have water that's tainted and has icky things like worms and what we call parasites, things that live inside of people. So in the stomach surgeries, they had to take care of some of those things.
Huh. Well, that's all we have time for today. Right, Dad?
All right. Thanks, Luke, and thanks for learning lots about Honduras.